Newborn Complications by Alex, Aislinn, and Morgan. By the end of this presentation, students should be able to identify complications of preterm and postterm infants, recognize the signs and symptoms associated with preterm and postterm infant complications, and understand the nurse's role in caring for preterm and postterm infants.
Complications. Although most newborns are born healthy and without complications, many factors during or after delivery can cause health complications that require specialty care. Newborn complications can consist of respiratory distress, thermal instability, hypoglycemia, jaundice, nutritional problems, neurodevelopmental problems, meconium aspiration, and persistent pulmonary hypertension of the newborn, or PPHN.
Respiratory distress occurs most often in premature infants. However, a small percentage of the late preterm and postterm infants can experience this complication as well. It is due to a developmental delay in lung maturation, resulting in an insufficient amount of surfactant to keep the lungs or the infant's lungs from collapsing. Incidences and severity can be lowered as the gestational age increases. Some signs and symptoms to include or to watch for would be nasal flaring, grunting, tachypnea, central cyanosis, and retractions. Some nursing considerations would be to monitor oxygen by pulse oximetry and provide supplemental oxygen as ordered. Thermal instability is very common in low birth weight infants because they have a smaller muscle mass, contain fewer brown fat deposits, lack subcutaneous fat, and have poor reflex control of skin capillaries to regulate their body temperature. Some signs and symptoms would include cool or pale skin, bradycardia, tachypnea, respiratory distress, and they may also have a feeble cry. Some nursing considerations to include are encouraging skin-to-skin contact between mother and baby or birthing partner, as this will help regulate the infant's temperature, and to implement measures to avoid heat loss, such as adjusting the environmental temperature and avoiding drafty areas.
Hypoglycemia is when an infant's blood glucose concentration is less than that needed to support adequate neurological organ and tissue function. It occurs most frequently in preterm infants who experience physiological stress, which causes a result of decreased glycogen supply, inadequate gluconeogenesis, or overutilization of glycogen stored during fetal life. Standard lab values in a term newborn for glucose is 1.7 to 3.3. Signs and symptoms include bluish-colored or pale skin, apnea, tachypnea, irritability, loss or floppy muscles, poor feeding, and thermal instability. Nursing considerations include initiating early feedings of breast milk or when medically indicated formula, and provide IV dextrose as necessary. Jaundice occurs in 80% of preterm infants, predominantly Asian and indigenous. It is due to an increased level of unconjugated bilirubin in the infant's red blood cells. Typically, jaundice will resolve on its own. However, if the bilirubin becomes significantly elevated, hyperbilirubinemia phototherapy may be required. Signs and symptoms include yellowing of the skin, yellowing of the whites of the eyes, and in the case of hyperbilirubinemia, the infant may be sleeping, fussy, floppy, and have trouble feeding. Nursing considerations include monitoring and noting risk zone on hour-specific monograms and encouraging early and frequent feedings. Feeding problems occur in preterm infants because various systems and mechanisms for ingestion and digestion of foods are not fully developed. They lack the maturity of the gastrointestinal tract, gag reflex development, and coordination in suck, swallow, and breathe reflexes. Signs and symptoms include difficulty coordinating sucking, swallowing, and breathing, physiological instability, and fatigue. Nursing considerations include initiating early feedings and watching for signs of inadequate feeding, such as sleepiness, lethargy, color changes during feeding, apnea during feeding, and decreased or absent urine output.
Neurological developmental problems in infants can be caused by trauma to the immature intracranial structures. This can lead to bleeding. Other things that can cause it can be changing in blood pressure, high blood pressure in the cranial blood flow system, or too much pressure in the cranial blood flow. It could be caused by improper coagulation or a predisposition for hypoglycemia. Signs and symptoms to be looking out for while doing your neuro exam would be seizure-like activity or seizures, hyperirritability for the infant, CNS depression, and abnormal muscle movements. For nursing considerations, we have performing the newborn screenings, implementing an individualized developmental care plan for the infant and its family, as well as encouraging the parents to keep follow-up appointments so that they can monitor the infant's growth and development, and of course, as always, patient teaching for the infant's parents. Meconium aspiration occurs in 10 to 15% of term and post-term births. It happens when infants aspirate a mixture of the meconium and amniotic fluid into their lungs around the time of delivery. Aspiration occurs because the infant is stressed out during labor, especially when it's past, when they're overdue. And that's one of the reasons why we really want to get in there and suck those out. The signs and symptoms for this would be cyanosis, respiratory distress, dark green staining or streaking of the amniotic fluid, or the obvious presence of meconium in the amniotic fluid, and limpness at birth. So another one would be obviously not breathing. Nursing considerations would be monitoring labor and fetal well-being during labor, notifying the appropriate team who is skilled in the neonatal resuscitation, and applying oxygen as indicated for an infant. Persistent pulmonary hypertension of the newborn, also known as PPHN, occurs when the newborn's system does not fully or properly adapt to breathing outside of the womb. This is because the blood vessel, ductus arteriosus, which kind of sounds like a Harry Potter spell, remains open when it's supposed to constrict and permanently close within the first day of life, allowing blood to be directed away from the lungs. Signs and symptoms of this are going to include tachypnea, tachycardia, cyanosis, which will then progress into severe respiratory compromise. A consideration that we nurses should have is optimizing oxygenation, monitoring perfusion, providing antibiotics as ordered, and providing parental support. And, of course, as always, patient teaching. Alrighty, guys, that's the end of our presentation. If you would like to go ahead and do the Kahoot to test your knowledge, that would be great. We also have a survey for you to complete if you have the time and would feel so inclined. I hope you have a good day and good luck on your final.